Lagos Traffic Radio 96.1 FM. Let's quickly see what's happening around the Okota Solo axis. Movement from Sele inward at Go roundabout is good in and out at this time. Sele Link Bridge inward Ijesha is also a good one. Agot Palace Way inward Apple Junction is okay. Akpata to Transformer Ilasa, it's good in and out. Inner part of Iriakari to Osolo Way also in good shape. Wanchuku Drive to connect Sele is not bad. Chemist in what Bako is good in and out. Okiafa to Bako, Ogberegbe Ishaga, College all through to Laspotek. It's looking very, very good. Palm Avenue, inward Daleko, it is good. 5-star to Jesha Express, it's okay. Both on the service lane and the main carriage. Before we get down to business, let's look at Aja axis. Vehicular movement within Aja and its environs still scanty and calm. Likewise at Obadori, Abraham Adesoya and Shongo Tedu receiving peacefully. Officers are strategically positioned to ensure that you have a good flow. All right then, that's about it for the traffic report for now. We will be updating you intermittently. Please, you can also keep us posted by sending an SMS or a message to any of our social media platforms. All right. The doctor of the future will give no medicine, but will instruct his patients in care of the human frame, in diet, in the cause, and in prevention of disease. This indeed is what we form the thrust of our discussion on today's edition of Your Side Mirror, as we focus on wellness on the wheel, the LaFiya's template. Good morning once again, and welcome to Your Side Mirror. My name is Taiwo Baruwa, and yes, I will be speaking with our guest this morning. We're going to be looking at wellness behind the wheels. I have with me in the studio Toye Mayomi. She is the head business development of at LaFiya Telehealth. Good morning to you, Toye.
Good morning.
How are you today?
I'm doing great, thank you.
Oh, you look sharp.
Thank you very much.
Okay.
Appreciate it.
All right then. So quickly, let's connect with LaFiya Health Telehealth. Let's look at assessment of Lagosians' healthcare on a scale of 1 to 100. What percentage will you give Lagosians when it comes to healthcare? Or should I say Nigerians generally?
Yeah, Nigerians generally, but Lagosians, because Lagosians actually are like a cross-section of what Nigerians are. We have all tribes.
All tribes, okay.
So, yes, so Nigerians and essentially Lagosians. I think Lagosians do okay with their health, but it could be better.
Really? How do you mean? When you say that they are okay, well, I mean, they can perform better.
Yes, so Lagosians are not really good with preventive medicine. They're not really good with preventive care. You see most people rush to the pharmacy or the hospital when they are sick.
Okay.
Shouldn't be that way. People should actually take care of their health before they fall sick so that they can at least keep the sickness at bay or prevent it if possible.
All right, take us through some of the things you think Lagosians should be doing to actually prevent being affected or falling sick.
Okay, so the first thing on the list is actually to do checks, health checks that could prevent them from having any issues. So like, for instance, the most common one is heart health. So by checking your blood pressure and making sure that you are always knowing what your numbers are when it comes to your heart health, you would be able to keep high blood pressure or a heart attack at bay. And one way they can do it actually is by having a self-check at home. So LaFiya Telehealth is actually giving people an opportunity to do this because you get to be able to do those health checks without actually going to the hospital to do it.
All right, let's now come down to LaFiya Telehealth now. What is LaFiya Telehealth?
Okay, so LaFiya Telehealth is like Uber for healthcare. You know, you can book a doctor, you can receive consultation, and even from specialists or general practitioners instantly. You know, the healthcare thing, the digital healthcare or the telehealth is a digital form of communication technology that people can use with their computers or mobile devices to access healthcare services remotely and manage their healthcare. So today, since people are connected, more connected online, they really would not want to waste time in the hospital waiting room trying to see a doctor, but they can do this on their phone or on the internet. It's very convenient and it's available for everybody, especially because medical professionals are disappearing in Nigeria.
Okay. Now you just mentioned it's available for everybody. What happens to those who don't have access to, say, internet? Perhaps they're out of data or the network coverage is quite poor where they are. What happens to them?
Okay, so we also offer a system that can help them to be able to do this remotely. So if they're in remote places, there is the LaFiya kiosk, where it comes fully loaded with its own internet service and solar system. So power will not be a problem, the internet will not be a problem because it's satellite based. And so if you're in a village or somewhere that you cannot access internet for any reason, you can use this.
Okay, if you say that it is accessible everywhere, I mean, is it across Lagos or across Nigeria?
Across Nigeria, not just Lagos actually.
Okay.
Across Nigeria.
Even in the remote areas?
Especially in the remote areas where we don't have a lot of doctors. Most doctors come to the big cities to find work, and then the villages are left out. So, but LaFiya Telehealth gives the opportunity to even people in the remote areas to be able to access care.
Okay. Is LaFiya Healthcare, is it a non-governmental organization?
Yes, it's actually a private for-profit organization, but because we love people and we love healthcare, we make this very affordable and accessible so that governments can actually key into these projects and buy these equipments for their municipalities. And even people, well-meaning Nigerians who have looked at the situation of things and have decided to help can also buy these equipments at a very affordable cost. There are even payment plans, so you don't even have to have the bulk of the money.
Okay.
It can be splitted over time, and then you can buy for maybe your village, your local government, just to help out for places where they can't afford quality healthcare.
Do you partner with health insurance organizations?
Yes, we do. We partner with HMOs, we partner with telecoms companies. We actually have the accessibility for all levels of businesses. SMEs can benefit, schools can benefit. You know, with the COVID-19 out there, many schools need to have sick bays. And those sick bays, you can't put a doctor in a sick bay. It's going to be too expensive. In some cases, you can't even have a full-time nurse be in a sick bay. It's going to be too expensive.
Okay.
But with the LaFiya Telehealth app and with the devices, there are different kinds of devices, and I would highlight them as we go. Now, with the LaFiya Telehealth app, anybody can access a doctor from the school sick bay. So it is cheaper for the school, it is easier for the student, and it gives the parents peace of mind when they're at home and their children are in a school that is powered by LaFiya Telehealth. So then for businesses as well, we have the LaFiya Telehealth card that is a medical card and can be reloadable.
Okay.
So business owners, employers can actually get this card, load it up, and then their staff can have it. Now, these cards can be used just for medical reasons. It can't be used for any other thing. So you can't even pay for something else with it.
Okay.
So it's safe and it is efficient and effective.
All right. LaFiya Telehealth sounds new to me. How long has it been in existence?
Yes, it's pretty new. It's been in existence for just about a year and 2 months now in Nigeria. Although telehealth in itself is pretty new in Nigeria, up until COVID, I'm sure most people didn't know that telehealth even existed. Maybe abroad, yes, it did. But during COVID, people couldn't leave home. And then most companies started looking more into telehealth. And that is why it is very, very important for us to have this conversation, because it's getting more and more important.
Did the pandemic birth this?
It didn't. Well, I wouldn't really say it birthed the whole concept of telehealth. It was in existence before, but I think it just made it more publicized, made it more public. More people started understanding what it was, and then getting to want to know about the value of telehealth.
Okay, now this is very interesting. Like you are almost everywhere, especially in the remote areas. Now, who can have access to your facility? We know that if you go to a hospital, there are some hospitals that do not have some certain facilities until you get to government-owned facility. Now, let's talk about your facilities and who can have access to your facilities. In terms of health concerns, you know, there are some situations that you cannot just go to health center. You have to visit the general hospital, or you go to a private hospital that, where they have good facilities. Who can have access to your facility?
Okay, so from what you've said, that they're talking about the kind of epidemic or the kind of things that can be treated with this telehealth. Okay, so there are so many. Interestingly, telemedicine have been able to address issues pertaining to allergies, maybe arthritic pain, asthma, bronchitis, cold, flu, diarrhea, infections, insect bites, conjunctivitis. The list goes on and on. Even sinuses, skin inflammation, bladder infections, UTIs, and even vomiting. And you know what? Even a surgeon might be able to use telehealth to do a post-operation check-in with his patient to make sure that the wound is healing properly, it's not infected.
Okay.
And the gynecologist might use a live TV live streaming to be able to access the patient, to talk about birth control, to be able to monitor the pregnancy as it's going, because we have a scan, a handheld scan attached to some of these devices. And then an endocrinologist, for instance, could be able to do a live stream or a video chat with his patients to discuss recent lab results or answer questions. So the uses are actually limitless. It's endless, really.
Okay. So do you do surgeries?
So for surgeries, you can only do that in the hospital. Okay. So for pre-operation and post-operations, those can be done via telemedicine. So essentially that would reduce the number of people actually going to the hospitals for non-essential things, because the hospital is not really a safe place when it comes to infections. You might go with one problem and then you get another infection from the hospital. So if it is not necessary for you to go to the hospital, telemedicine can help you handle the issues with the same doctors who work in these same hospitals. So it's not even like the doctors that are going to be taking the jobs away from the doctors. The doctors still have their jobs. They're only doing it more efficiently now with telemedicine. All right then.
Lagos Traffic Radio 96.1 FM. It is still the Monday edition of Your Side Mirror. Quickly, let's look at what the roads are saying again. Around Airport Road, movement from NNPC inward Kano is busy but moving. Chivita inward Lukmana Tobajeon inward Swimming Pool is slow. Hollandia Way inward Eleganza is good. Approaching Jesus House to Ajao Gate is slightly busy. From Aye inward Aswani through Solo Way is good. Approaching Afari Ogun to 7 and 8 is busy. Onward journey to airport is very much in order. All right, I have been speaking with Tonya Mayomi here on Your Side Mirror, and yes, we're talking about LaFiya Telehealth. Of course, we have discussed a couple of things, what telehealth is, and yes, she's been able to explain to us some of the things you have access to and things that you need to get to the hospital to get attended to. Now, let's look at some other things that you do. During consultation, how do a doctor identify what the problem is with a kind of patient that you need to actually see to know that, okay, this might be the situation with this person?
Yes, so definitely telehealth can address a whole lot of things, but it cannot address everything.
Okay.
So like I listed before, the things it can address. So this is how it works. The patient can discuss his or her symptoms via video consultation and then get prescriptions sent to them. We're actually partnered with GoCada to take those prescriptions to them. And we are also partnered with big pharmacies in Nigeria and even local pharmacies in Nigeria, so that when the patient gets a prescription, these pharmacies can fill out the prescription. And we want pharmacists to also go on LaFiya Telehealth and actually sign up because it will make it easier if the pharmacies are close to the patients, then they can pick up their prescriptions on the road. Another way is during a consultation, the patient can have a self-guided service diagnosis from the doctor. So the doctor will tell you, put the stethoscope close to your heart, and the doctor will be able to read how many beats per second. The doctor will be able to tell if your heart is healthy or not. And there are other equipments that can check the skin, the eye, the ear, and all of those. So diagnosis can actually be guided and done by yourself.
Okay, you just mentioned now that you partnered with GoCada. Why GoCada? Because in some cases, you have a patient call in, and then you're trying to see one or two things. There are chances that, okay, this person needs to be seen in person to actually ascertain what's going on. How do you go about that?
Okay, so for patients who do not need to go to the hospital, we use these services. We get the diagnosis done, and then the prescription is sent to the patient. But for patients who, when the doctor checks the first level, the initial consultation is done, and the doctor thinks that you need to be seen by and you need a physical examination, then you'll be sent to a hospital. It can be the hospital you already use, but if you're like a HMO patient, you can use pretty much any hospital that your HMO uses. But at least that initial consultation is done, carried out successfully by a general practitioner. Then you can now go to see a specialist in person.
All right, considering the brain drain of doctors leaving the shores of Nigeria, how does LaFiya Telehealth address the medical deficit in the country?
That's actually a very good question. So I saw the video that recently went around with doctors doing like interviews to leave Nigeria. So telemedicine can help with, the reduction of the numbers of doctors, because telemedicine was actually originally created to be able to treat people where doctors are scarce, where doctors are limited, like in remote places. So if the doctors are actually leaving the shores of Nigeria, they can still attend to Nigerians because it's online. They don't need to be physically here, to be able to do that. And then doctors that are, still here can be able to address more serious issues after the first consultation has been done, if necessary. But if it is not necessary, they would still be able to do their jobs from anywhere they are and then get paid.
Okay, let's come back to the way you operate now. You operate remotely, so to say. Now,
Right.
Let's look at it from this angle that, the way the population is, not everyone is that educated, let alone being able to do mobile transfer and all that. Now, I want to consult one of your doctors. How do people get to pay you? Or is it free?
I wish it were.
Okay.
But because we have to pay doctors and all the other stakeholders, we cannot make it free. However, the prices are highly subsidized, and the payment is made on the platform. It is very easy. There are several methods of payment. There's the bank transfer, there's the USSD, and there is the wallet funding one type of payment. There are so many. If anybody can do it, can pay for anything in Nigeria, they can pay for this, because you can either use your card, you can do a transfer, you can use a USSD, and everything is done on the same page where you would see the doctor as well. So it's seamless, really.
All right, 0809-9120-777 is our studio line, or you can call us on 0915-367-7127. Put a call through, or you send an SMS. If you have any concern, if you have any question you want to ask, you can put a call through, and Tonya will be here to respond to your question. Let's get down to another question now. Can healthcare facilities existing now benefit from using this service with LaFiya Telehealth?
Sure. Currently, healthcare facilities can use the service. They can create virtual appointments for their patients. So some clinics have provided virtual appointments to enable the doctors, their own doctors or nurses, see patients via video conferencing. They can also use the service for remote monitoring. And so if a patient is bedridden at home, or a patient is unable to come physically to the hospital, The hospital can monitor the patients using our devices. There's the standing indoor kiosk that can be used to be able to see the patient and be able to access all of the patient's body with all of the diagnosis needed to do those routine checks. And the doctor will get all of the results in real time. Then there's the personal health record of the patient that can also be imputed, and the doctor can see that in real time. So professionals, doctors do not really have to leave the hospital to take care of patients at home, their own patients in their own hospitals. If this can be done remotely, it limits the stress on the doctors and retains, their for them to be able to do their profession properly.
All right, then. Let's quickly see what the roads are saying around Ikorodu. There is an ongoing peaceful protest by yellow bus drivers around Unikbani, Wadfadeyi, causing slow movement at this time from Obanikoro. All right, if you're on Ikorodu Road at this time, please be patient, okay? Earlier on, there was an impediment also at inward in the Independence Tunnel. So please, if you're using that corridor, look out for that impediment. Again, 0809 9120777 is our studio line. You can also call us on 0915 3677127. If you have any question or you have any concern whatsoever, you can put a call through to us or send an SMS. All right, again, on Airport Road, movement from NNPC inward Keno is busy but moving. Chivita inward Lukman Atobajon connecting swimming pool is slow. Hollandia Way inward Eleganza is good. Approaching Jesus House to Ajao Gate is slightly busy. From Aye inward Aswani through Osola Way, it's also a good one. Approaching Afario Good 7 and 8 is busy. Onward journey to airport is very much in order. Around Aja, vehicular movement is still very much in order. At Obadore, Abraham Adesoya, Shongotedo is not bad at this time. All right, a lane at the PRT corridor at Ikeja along Inward Ajayi Farm has been cordoned off as a result of traffic emanating backward PWD. All right, it's still your side mirror here on Lagos Traffic Radio 96.1 FM. The Monday edition. We'll go on a short break and be right back.
Hello people, this is Tony Adebola. How do I describe myself? Well, an entrepreneur and an adventurer. I just want to tell you, keep listening to Traffic Radio, cause Traffic Radio rocks.
Time don't reach. Make we take show love for our city and the better people of Lagos. We must join hands together with the government. Our people talk and say, na cooperation they make rice in the food pot. So therefore, my people, obey all traffic rules. Not they pass one way. Arrange your car well, so that you don't go yamutu for road to avoid the traffic again. And also obey the traffic light. And make sure say all your car papers they complete and obey traffic officers. So remember, clean environment will give you good health. Not the throw away dirty and yama for inside gutter, street or for canal. Make you not carry noise or smoke they pollute our environment. Kai, LASMA, police and other law enforcement agencies will make sure say they do their work well. Support Sonwo-Olu and Hamza. That when we say you must do the right thing.
This is a public service announcement by the Lagos State Government.
Mommy, remember you said you were going to buy me a new school bag?
Oh, Annie, darling, that's true. Don't worry, we'll stop at the next store to get it. Wait in the car, let me go get it.
Madam, don't tell me say you won't leave this pikin inside this motor come out too.
Abba, waiting up, I won't buy something.
Say you no know say the pikin fit faint inside this motor or make them kidnap and come out. We don't see him before.
Any talk, come, let's go together.
My country people, una don't hear am. Make una know they leave small pikin alone for more to come out. Because the pikin body feel hot well. We feel lead to waiting Oyibo people might call heat stroke and other yama sicknesses. Even accidents feel happen. Our pikin our future and their safety now our bonge concern.
Na Lagos Traffic Radio 96.1 FM. They bring on this message.
Lagos Traffic Radio 96.1 FM. The phone lines are open, and yes, I am still here in the studio with Toye Mayomi, and yes, we're looking at wellness behind the wheels, the LaFiya template. Now, let's quickly look at how motorists can actually benefit from this.
Okay, so motorists are supposed to keep their eyes on the road, not receive phone calls and all of that. So they definitely would not be able to talk to a doctor while they are on the road, just to keep safe. But because they can download the app, they could have, before the motorists leave home, the app could give you information about your health for the day, give you tips on how to remain healthy for the day, maybe tips like drink a lot of water, make sure you take walks in between so you're not sitting down in the office all day. You know, many people are very sedentary. They don't go around a lot, and that can cause muscle spasms and can make people have, over time, have a lot of issues with their health, their back, waist, and then their knees. So walk around a little bit. So all of those health tips would have been sent to an individual who would be driving, and the person already knows and have this at the back of their mind to keep a healthy lifestyle while on the road. Things like not picking up buying food in traffic, things like not making calls in traffic are reminders that can actually be sent by healthcare professionals, either hospitals or HMOs or generally individuals on this app. So we can white label the app for companies or hospitals. So on the front end, the patient or the individual is seeing your hospital, but at the back end, all of the algorithms and APIs will have been constructed such that LaFiya Telehealth would work with your hospital to make sure you have a healthy life.
All right, we have a question here from a listener. It says, is it possible to have telehealth monitor blood sugar and blood pressure on regular basis?
Absolutely. So there are some of our devices that are also for sale. They're actually add-ons that people can purchase, or either on our website, or they can call in to check their blood pressure. And everything is AI managed. It's artificial intelligence. So you don't need a cord, or you don't need, it's just Bluetooth. So in the Bluetooth will sync with your phone, and your doctor will get instantly all of your parameters that is needed to know your heart condition. That is for the blood pressure. Now for the blood sugar, there's also a check for that, a drop of blood on it, and it immediately gives your blood sugar reading, and your doctor sees it in real time as well.
Wow.
So keeping healthy is now so easy. So that's why we are partnering with HMOs, hospitals, and all other establishments to be able to keep their staff, their customers, their children healthy.
Let's look at some of the challenges prospective patient might experience in terms of network coverage and all that. Now, we all know that even when you want to order a ride on either of these platforms, there are times that you have challenges with network. There are times that, there are other challenges such as search. Do you experience such?
Yes, we do, and that is why we have the offline system as well. All of these things can be checked offline, and whenever the network is back on, it syncs to your devices. So, for instance, you check your blood pressure right now, and for some reason your network is fluctuating, or your doctor's network is fluctuating. It would save everything. You don't have to wait till the network is going on smoothly, and even in an instant, as soon as it is possible for the network to flow, the doctor gets all of the readings and you get all of the reports. If it is the other way around and the doctor is giving you reports or giving you prescriptions, you get it immediately. You have the slightest network. So it is the way it is programmed on the internet. It uses very, very, very little bandwidth to be able to activate.
Okay.
So the correspondence is actually very fast, even if you have the slightest network in. And that is if, of course, you're not in a remote place where we have our satellite. The network is always very fast, so it's not even a problem. Yes.
Okay. In a situation whereby there is an emergency situation, and then somebody is trying to get in touch, the network is poor. Can one connect via telephone call or something?
Sure. So we're activating the chat response very soon.
Okay.
That's not yet on the program, but it is very, very soon, such that immediately, and we're trying to partner with some ambulance emergency services, so that on the touch of a button on your phone on the app, you would be able to access ambulance services to come to you, because it's AI powered. They can know your location with your phone.
Lagos Traffic Radio 96.1 FM. Again, you can connect with us on 0809 9120 777 or 0915 3677 127. All right, there is a broken down load at Teapot at Ajao Junction, navigating towards Agor Palace Way, having a gear problem. Effort is on to get it out of the road. Of course, let me also remind you about the peaceful protest ongoing by yellow bus drivers around Onikpan, inward Fadeyi. It is caused a slow movement at this time, so please just be patient as you make your journey through. All right, now let's talk about how you handle your patient. Now, should that be an emergency situation and you want to... Okay, we have a caller. Hello, good morning. Oh, we lost that call there. All right, please do put your calls through again. Let's hear from you. You have any question, you have any concern, 0809 9120 777 is the number to call. And yes, you can also send an SMS if you're not able to get through to us via telephone call. All right, tell us about LaFiya standing indoor kiosk. What is this about?
So the LaFiya standing indoor kiosk is actually like a robot doctor. That's what I call it, because it's so packed with so much goodness, and it's almost as if you have a doctor standing there 24/7. Hospitals can use this kiosk. I'm going to describe it as much as I can. It has a screen, like a TV screen, and then it has a camera at the top of it. The camera can move and can show every part of your body. We are working on getting the camera to be able to take your blood pressure, heartbeat, and all those other things. But for now, we have devices that are also on this standing kiosk. Now, this indoor kiosk can check the eyes. Another device can check the ear, the eyes, the lungs, the heart. Everything can be checked on this indoor kiosk. And it can be used everywhere, not necessarily at home. It can be used in hospitals. It can be used in ferry stations, train stations, bus stations.
Okay, hold your thought there. We have a call. Hello, good morning.
Hello, good morning.
Good morning.
Yes, my name is Patrick. I'm calling from Lekki.
All right, Patrick, go ahead.
Yeah, I just wanted to find out from the lady in the studio. Thank you for having her. Just wanted to find out. So if we have cases like car accidents on the road, how would their app be very valuable for us to call emergency services?
All right. Thank you so much, Patrick, for that question.
Thank you, Patrick. So for now, we're trying to partner with ambulance services so that people can just make a click on the app, and then their location would be shown to these ambulance services, and then they can come right there to pick up the patient. And the patient, even if you do not have enough funds to pay for these ambulance services, the ambulance services, since they are going to be partnered with us, they will be able to take you to the closest hospital. And because you already have our app, we would know your hospital and your doctor, and we can inform them that we are bringing you to that hospital. So saving lives is part of what we do, and that is why LaFiya Telehealth is a go-to place for all healthcare needs.
Okay, saving lives is what we know doctors for, or healthcare givers. That's what we know them for. But in this part of the world, there is this thing that has been on for years now. You take an accident victim to the hospital, and then the caregivers are asking you for doctor's report, they're asking you for this, asking you for that. Is that the case at LaFiya Template?
Okay, so LaFiya Telehealth is not a hospital, but we help hospitals work more efficiently. So what we would do in such what I can say in such situation is that healthcare is expensive, and a lot of things used by healthcare professionals are actually imported, making it even more expensive now with the dollar rate increase and all of that. So sometimes sadly it is difficult for hospitals to want to make treatments without a deposit or without going to get all of those medical reports because they need a prehistory. But not to worry, LaFiya Telehealth helps with all of that. Because if you're on LaFiya Telehealth app, all of your information, all of the things you are allergic to, the drugs you are on, your last scan, your last report, medical reports, everything is securely stored on your app. And so the doctor is not guessing. The doctor already knows everything that has been wrong with you. So the reason why they actually ask you to go get a doctor's report and all of that is because they're not sure if there's a problem that treating you would now make worse. So for instance, somebody who already is dealing with diabetes, high blood pressure, migraines, there are certain medication that you cannot administer. So even if that person is brought to your hospital with an emergency, you have to be sure to get all of those reports.
All right, hold your thought there. Hello, good morning.
Yeah, hello, good morning.
Good morning.
Yes, my name is Usara, calling from Lekki.
Okay.
Yeah, I just called to, commend the lady in the studio and what they're doing. I don't really have questions, but man, I just want to give them thumbs up and encourage telehealth companies to continue its good work. I've done a little research on the company. It's really, really good. So please just extend my warm regards to her. Thank you very much.
Thank you so much for the call.
Thank you. Thank you.
All right, let's get back to business now. I was going to ask you, do you require a police report to take any action whatsoever in terms of accident situation?
No, we do not. Usually hospitals do. And the reason is if somebody is brought into a hospital bleeding, you want to know what happened. If it's a stab wound, if it's a gunshot wound, you want to know if this person is actually running from the law. And then you don't want to be a culprit by treating this person without getting the report from the police. So it is another issue for the medical community to handle. But we giving you that initial care, because we're not a hospital, we are not taking that liability. We're just going to get it to the hospital, and then we'll allow the hospital to do their own job from there.
Okay. LaFiya Telehealth has been in existence for over a year now. How has the journey been so far for you?
It has been a good ride. It's had its issues because it's new. And for everything that is new, definitely there are hiccups here and there. But so far, it's been good. A lot of people are beginning to realize that they need to do more checks on themselves, and a lot of people are beginning to see the significance of telehealth. So I can say it's actually good, but it could be better. That we need to learn more about the benefits.
Okay, so take us through some of the challenges you have encountered, in the past 1 year.
Okay, so calling up people, going to cold call some doctors to sign up, because we actually need specialists to be on the app. Doctors, general practitioners, specialists, and all of that. And because they don't know it even exists, we have to kind of connect with them, call them, make them sign up, and tell them the value proposition for them, that they're going to actually get paid for any consultation they make and all of that. Then again, another problem we've had is signing up. People are really not good at filling forms. Now, because it's a medical app, those forms have to be filled, because we will deal with a lot of liability issues if a doctor, for instance, is not properly documented, does not have his license renewed and all of that. So on the back end, we have to make sure that things are done properly. And then on the front end, we also have to make sure the doctors have the time, because they're always so busy, to actually fill it. So going through all of those processes is actually very taxing. And I'm sure with time, things would level up and people would be able to understand why it is important to be able to do this, fill out these forms correctly. And not just that, when people are sick, sometimes they don't want to feel like a 3-page form. So
I can imagine.
We keep trying to make the app easier, more user-friendly, trying to tweak the user interface to make sure that people can actually sign up almost immediately and not have any issues. And so we encourage people to sign up to the LaFiya Telehealth app before there is an issue. It is not okay to sign up when there's an issue, because then you are fighting too many battles. So sign up today, make it easier for you and for us when you are ill.
All right, you can still connect with us on the show this morning. 0809 9120 777 is the number to call, or 0915 3677 127. All right, there is a broken down loaded tipper at Agor Junction, navigating towards Agor Palace Way, having gear problem. Effort is ongoing to get it off the road. Again, let me remind you, Idiroko inward the Independence Tunnel, there is an impediment there. Earlier on, we got a report and from the traffic manager around that area, and he emphasized that the impediments cannot be towed. It has to be fixed on that spot. So please look out for that impediment. Of course, it is against traffic this morning, but please just be on a lookout. For those on the Ikorodu Road, still on the same corridor, there is an ongoing peaceful protest by yellow bus drivers around Onikpan, inward Fadeyi, causing traffic from Obanikoro end. So please be patient if you're around that area. All right, around Okpebi Allen, the traffic is still good for now. Aromire inward Allen intersection is busy. Kudra Tabiala way from Radio down to Ojota U-turn, it's a good one. Welfare towards Adebola House through Okpebi Link Bridge is a good one. Adebola House to Salvation down to Sheraton Link, no cause for alarm. Okpebi U-turn, Toyin inward and outward of Custom. Toyin roundabout, inward journey Allen down to Allen intersection, it's also good. Ikeja underneath the bridge to Allen intersection is good. Down to Radio. Traffic managers are on ground managing the situation. All right, yes, I have been speaking with Toye Miami. Quickly, you have taken us through some of the challenges you have encountered in the past couple of months. Now, tell us what has kept you going.
Thank you. So, like every Nigerian business goes through ups and downs. So despite the challenges, we've also had very, very good partnerships that has helped us realize that what we are doing is actually great. So for instance, do you know that with LaFiya Telehealth, you can actually get treated and pay later?
Really?
Yes, it's awesome, right? So we partnered with this company, Any Health. And Any Health is actually a payment, health payment service that would pay for your health care, and then you can pay over time. So if you don't have money, no problem. They would handle it, and you'll be treated by any of our doctors, and then we would definitely you can pay that money later. It's a very good partnership that we have with them, and we've also partnered with some other companies like MedPlus, to be able to provide prescription fulfillment for our patients. Also, I remember I mentioned about the police report thing. We would also have on our platform the opportunity for you to put your job, what you do. So the hospital is easier for them to treat without actually asking for a police report. Because if you're a responsible citizen of Nigeria and you work in a reputable organization, nobody's going to think that because they don't have your past history, you are a criminal and ask for a police report.
Okay.
So that's why I keep saying that everybody should be on the app, because all of this information will be on your LaFiya Telehealth app. And so once the doctor picks up your phone, he can see that, oh, okay, you work for 96.1 FM, and you cannot be somebody running from the law, because you have a job, you have somewhere they can trace you if there's a problem. So all of those information will be there prior. So it helps in so many ways to get on LaFiya Telehealth App.
Oh, that sounds pretty cool. I mean, having your information all online there, and so it is easy for anyone to actually have access to the kind of person you are without hesitating to actually treat you.
Exactly.
All right, let's look at some kind of issues. I know that in some hospitals you have cases like patients being remanded for not being able to pay medical bills. Have you had cases like that?
No, we actually have never had cases like that because most of all the payments are done on the back end. So if, like I said, if you cannot afford to pay for your medical bills, any health will pay for your medical bills. They are partners as well. And so you can make the payments later. You wouldn't need to be reminded for not being able to pay your medical bills. And this is no matter how much or how little your medical bills are.
Okay, so how can people access the platform?
Okay, so there are so many ways they can reach us. They can reach us on via telephone on 0806 990 6603, and they can reach us on all of our social media handles. Instagram is LaFiya_telehealth. That will be for Instagram. Then for LinkedIn is LaFiya Telehealth. That's for LinkedIn. For Facebook as well, LaFiya Telehealth. That's for Facebook. Our physical address is number 40, Fola Oshibo Road, Lekki Phase 1, Lekki, Lagos, Nigeria. And our email is info@lafia.app. That's a lot.
Okay,
to take
let's
in.
take one more call. Hold your thought there. Hello, good morning.
Hello, good morning.
Good morning.
My name is John. I'm calling from Agege.
All right, John.
Yeah, I just wanted to find out from the young lady, how do we take care of our records to be safe, especially in this data world where we don't know what's gonna happen to our records. So how do we guarantee that our medical record is safe if we have with LaFiya? Thank you.
All right, thank you so much.
Thank you, sir. So the question is a very valid one. A lot of people are afraid these days of their information being hijacked by hoodlums and internet thieves. So what we've done is backup end-to-end encrypted. You know the way a device is encrypted end-to-end, so there's nothing that can seep through the cracks. We have a fully integrated encrypted system that makes it impossible to be hacked. And so your number is safe, your information is safe, your children's information is safe on the platform, because we also cater to schools, providing them cards, school cards that they can use for health reasons. And so all of the child's information, the allergies the child might have, and all of those things would be on this card, will be loaded on this card. And so we know how valuable it is for parents to have their children's information safe, yes. And so we have done all of this on the back end, and you can be rest assured that LaFiya Telehealth has got your back for health when it comes to your data. It is very safe.
All right, then. I have been speaking with Head Business Development at LaFiya Telehealth. And yes, this morning we have looked at wellness behind the wheels, the LaFiya's templates. Of course, it's been a very insightful conversation this morning. And let's see. You can connect with them on 0806 990 6603. Of course, you can download their app on Google Play Store. If you use an Android phone, of course, if you use an iPhone, you can actually download on iOS. All right. Big ups to my producer this morning, Folashade Aderomu. Thank you so much. I appreciate. To the ladies in the studio, thank you so much for coming on the program this morning. Tonya Mayomi, thank you so much for coming. My name is Taiwo Baruwa. The program has been produced by Folashade Aderomu. My executive producer is Tayo Akonle. Do enjoy the rest of your day.